movement against the protests planned across the country for Monday, including here at the Toronto General Hospital. The protests, they say, are interfering with patients who need life-saving care and with the nurses and doctors trying to get into those hospitals to provide that care. For example, earlier this month at St. Paul's Hospital in Vancouver, an ambulance transporting a patient who had been critically injured in an industrial accident on the waterfront and had arterial bleeding was delayed getting to the hospital because of one of these protests. Organized by a Christian group aiming to end lockdowns by opposing public health measures that are intended to do just that, the protest at Toronto General Hospital today is one of 17 planned across Canada. Toronto Police tweeted Sunday that they would lay charges if necessary.
People to know about how you're feeling about what's going on today?
For the patients and staff behind me, this is very sacred, kind of hallowed ground where it's a place of curing those who are injured and very ill. To protest on the site of a place of healing is honestly a defilement of this hospital. This is a very great hospital where great medicine and great nursing is done every day. And it is very distressing and demoralizing and repugnant to protest at this acute care hospital at this time where the nurses and the physicians and the respiratory therapists and the cleaners and the administrative staff have done their best for 2 years to try and help our population. But I take great heart in knowing that the majority of Torontonians and Ontarians support their nurses and doctors and are not the minority that we are seeing here today. And while I respect their right to protest, the laws of our land were not written in the building behind us. They were written at Queen's Park, and I would respectfully ask protesters to direct their protestations there, not here. This is a place of healing and of cure.
Most of the people who have already been received the injection, they're the ones ending up back into the hospital.
Yes.
And that's why we say, you know, we trust in the Lord, not Doug Ford.
I'm here because a couple of weeks ago, the anti-vaxxers tried to block off the ambulance entrances and delaying the ambulance by 4 or 5 minutes could have cost the lives of many people. My activist friend Nico and his 4th degree black belt, many friends chased him away and saved quite a few people's lives this day, and I'm actually proud to be a part of that.
It's an experimental biopharmaceutical injection. I'm grateful for people who are taking them because I'm not, and I will wait and see the long-term data of this global experiment.
I have a lot of family that's in healthcare. I've seen the hell that they have to go through. A lot of them didn't even get the extra pandemic pay due to the job position they hold, and they're the ones that are testing for COVID. And these people are fighting a fight to keep my family, people in these hospitals, in precarious positions. And I wanted to make sure that facts were coming through and that a counter protest point was offered. So that's why I'm here today.
The Registered Nurses Association of Ontario and the Ontario Medical Association are calling for public health safety zones, as has also been proposed by the provincial NDP. These would make it an offence to block entries and exits to hospitals for staff and ambulances. This proposal will have to wait until Queen's Park resumes after the federal election. Police say there are no reports of hospital staff or patients being obstructed today. This is Nicole Stoffman reporting for the Annex.